Good afternoon, everybody. Quick question. How many of you like spaghetti? It's great, it's long, it's tasty, it's wonderful. How would you like spaghetti-like worms crawling through your veins, trying frantically to get to your heart so they can eat it? I don't think so. I didn't think anybody would like that. How would you like that for your enemy? Maybe, possibly. What about a friend? Your best friend. I certainly know I'd hate for that to happen to my best friend. My best friend happens to be right here. She's a sweet little terrier called Irene. And I do everything I can to keep, in case you haven't guessed it yet, heartworms from getting to her. Now, what are heartworms exactly? Well, according to the American Heartworm Society, heartworm is a disease of severe and potential fatal disease in pets in the United States and many other parts of the world. It is caused by foot-long worms, that look like spaghetti, that live in the heart, lungs, and associated blood vessels of the affected pets, causing severe lung disease, heart failure, and damage to other organs of the body. Very serious disease. Don't need to take it lightly. Now you might ask yourself, okay, I want to know how to prevent this, and I want to know if my dog has it. Don't worry, I'm going to let you know all those things in good time. For starters, the symptoms, so you know whether or not your dog has heartworm. The symptoms come in 4 stages. First stage is really hard to tell if they have. It's mild symptoms such as an occasional cough. You might think, well, my dog just ate some grass. He's trying to get up something that might be giving him a little indigestion. So very hard to notice the first stage. The second stage is cough or tiredness after moderate activity. Still very easily dismissible. You might think, oh, it's nothing. Now the third stage is when it gets pretty serious. General loss of body condition, persistent cough and tiredness after mild activity, trouble breathing, and signs of heart failure. That's when you know you've got a problem, you really need to take your dog into the vet. Now the fourth stage is the most deadly stage, the one that can really cause serious harm to your dog. This stage is also called the cable syndrome. It occurs when too many worms clog up the dog's veins and blood vessels. It's at this stage that surgery is required and the other treatments are no longer effective. By the way, I got that information off of WebMD, odd enough. Works for humans and animals. Now, as far as treatment and prevention, this is the stage I really want you guys to focus in on because it's the stage I'm really harboring on right now. Now, the best way to treat it is to prevent it. There's lots of great ways of preventing heartworm from ever affecting your dog. For starters, there are monthly pills you can give your dog, a monthly topical that you put right onto the skin, so in case your dog doesn't like taking pills, it's an easier method. Or if you're kind of forgetful, there's a 6-month injectable medicine that you give them every 6 months, so that way you don't have to worry about consistently giving it every year, or every 6 months, I mean. Now, of course, once your dog actually has heartworms, that's whenever a prevention method isn't very useful at all. They actually have to give it an arsenic-based shot 2 to 3 times over the course of the treatment, and the prices of the blood work, the x-rays, and the medicine can be up towards $1,000, so trust me, prevention is the best way to go about preventing heartworms. Now, I have here are a couple of pamphlets I'd like you to take with you that have information about heartworm and the various ways of treatment and prevention, so I'd like to give one to each one of you. Thank you, and please, by all means, keep your dog from getting heartworm, because it's really bad once they get it, and it affects many dogs throughout the United States. And it's summertime, it's the best time for mosquitoes, which are the carriers of the disease, to actually attack your dog and infect it. So, get them treated. Thank you.